One of the reasons that I think human rights must occupy the center of the HIV struggle, and now more than ever, is that right-based responses to HIV are very practical and they work. People tend to think that human rights is this foreign and alien concept out there and it can't be done. One of the ways in which we are ensuring that human rights are delivered to people in a very practical way is we are supporting integration of legal services into HIV treatment programs. What we've done is to train the health workers to be able to know what are some of the human rights principles that I must adhere to as a health worker to ensure that I don't violate the people who come for treatment. Number two, we also train them to ensure that once they encounter the people living with HIV who are also suffering other violations that may not necessarily be health related, that they can actually be able to pinpoint and identify them and refer them to places where they can find treatment. For instance, when a woman presents to get her ARV treatment and she, in the discussions with the nurse, she says, I don't even know how I'm going to take my medication because I don't have a home. I've been thrown out. And she, in the discussions with the nurse, she says, I don't even know how I'm going to take my medication because I don't have a home. I've been thrown out. Is the nurse going to disregard that information, or is the nurse going to be able to act on that information? We are training them to ensure that if they encounter those cases, that they are able to identify them and tell them, now I will send you to a place that can be able to assist you get your house back or find an alternative accommodation. Apart from training the health workers, training the people themselves who are living with HIV to be able to demand for these rights. When you go to a health facility and you feel like you haven't been given adequate time or adequate counseling for you to be able to decide about your treatment, then you need to be able to raise that with your health provider. You need to be able to say, I think I don't feel sufficiently informed to be able to make decisions about this treatment, and being able to seek that sort of redress. And also, not just at the health facility, at the community level. When you see these violations happening at the community level, when children are being denied going to school because of the HIV, they can be able to get together and mobilize and say, no, this is not right. Then the other aspect that we are doing is to support grandmothers, because we have a pandemic that is that has led to a lot of orphans. Parents have died, both parents die, and you have children who are left at the care of elderly grandparents who don't have information and who also don't have the means to support these children. So one of the other things that we are doing is to actually support these grandmothers with information about what it is that they need to do, how to address some of the challenges and the violations that they encounter, and also giving them support economic to start income generating projects that to enable them be able to take care of these children. Another very practical intervention is working with survivors of rape, integrating legal services again for survivors of rape. And this is where you ensure that again in the health facilities or outside of the health facilities, that those people who present themselves as having been raped, number one, get the right counseling, get the right post-exposure prophylaxis treatment, and they also get counseling, legal counseling, that to give them the various options available to them. Do they want to seek legal redress? Do they want to pursue the violation of rape? Do they want to sue the perpetrators? And being able to make that a comprehensive package, that they can get counseling, they can get post-exposure prophylaxis treatment, they can get legal redress if they want to, and therefore being able to give them holistic treatment. So rights-based responses are not that expensive. They are not wild. They are real. They are practical. They can be done. They are achievable.
For further information on human rights, HIV/AIDS, and to endorse now more than ever the joint statement, visit www.hivhumanrightsnow.org.